In today's video, I am really excited to once more talk to Dr. Ania Weissman, an aesthetic radiologist who has been on my channel several times. In today's video, we will be talking about facial fat loss, which is of course something I dealt with this year. And from your comments, I know that many of you deal with facial fat loss as well. So we will be talking about facial fat loss and ways to treat it. We will also be answering some comments you left for Dr. Ania under our last video, as well as clear up some confusion that was created around peptides. So without further ado, let's talk to Dr. Ania. Thank you so much for being back with us, Dr. Ania.
I am so happy to be here. I love chatting with you.
Likewise. Let's get right into it. We had a couple of questions under our last video. One of them was, we talked about under eyes, sunken in under eyes, or the under eye area in general. Mm-hmm. And you mentioned that certain lasers can be helpful for the under eye area. And I got the question quite a bit, which lasers?
Okay. So in terms of brands, because there are so many, I wouldn't focus so much on that, but I will say skin resurfacing lasers are exactly that. They resurface the skin. What they do is they boost the production of collagen and elastin. And in the category of resurfacing lasers, we have ablative lasers and non-ablative lasers. So an example of an ablative laser, which is extremely strong, is the CO2 laser. And even though it's a very strong laser, the settings can be changed so that it's quite a gentle laser, or you can have a downtime of up to 2 weeks because it's so intense. Now, obviously, the settings for the under eye area would be more gentle than for the face, but that is one laser that could be performed, I would say, less than once a year. So once every 2 to 5 years because of its strength. Then there are non-ablative lasers. And the difference basically between ablative and non-ablative, what that means is either the superficial layer of the epidermis is affected and ablated, or injured through thermal energy, or it's spared. So the non-ablative lasers, like Fraxel, for example, Clear and Brilliant also, which is a very delicate laser, they spare that epidermis. So that's why they're called non-ablative. They don't really treat that superficial layer, which means your downtime is less, which means you still have that protective layer of skin on your face after the treatment. Whereas ablative, it just burns right through. And so that's why the downtime is more. You need Aquaphor or Vaseline. Otherwise, you're losing so much water through, it's not even transepidermal water loss, it's just loss through open wounds, microchannels. So those would be the categories. And in the non-ablative, as I mentioned, there are stronger lasers like Fraxel, but I wouldn't pay so much attention to the name. I would just question my doctor or provider in terms of what is the energy? Is it ablative, non-ablative? How many treatments can you have a year? With a laser like Fraxel, you could actually have that laser perform multiple times in 1 year. You could have it 3 times a year. And lasers like Clear and Brilliant are so gentle that you could almost do them every month. That might be a bit much, but every 2 months you could absolutely do it. So the more gentle lasers can be performed more frequently, and the more aggressive, deeper lasers less frequently. And I think I'm a fan of the more gentle lasers. And again, it's because when you do really deep chemical peels, or when you do really deep laser treatments, I find that over time that the skin changes a little bit. The pigmentation of the skin changes a little bit, and people start to look a little bit like a porcelain doll. And so I prefer, I'm always saying baby steps, or, less is more. And so more frequent treatments that are more gentle, I think, are better.
Okay.
But I think that is for anti-aging and skin tightening and collagen and elastin production. Other lasers for the under eye area, if the problem is pigmentation, which is due to vascular causes, there's a laser called V-beam, or a pulse dye laser, which can help reduce that pigmentation. That's a very, very strong laser. So you have to find a very experienced, good provider to be able to safely use that laser around the eye area. And lastly, it's not a laser, but I would say it belongs in the family of these types of treatments, are energy-based devices. Like, for example, DoNotAge. I'm not personally a fan because I just haven't seen the results. But I think, like with anything else, when you take one device, some people might have a beautiful result and other people will say it was a waste of money. It didn't do anything for me. And it's because we're all different. But that's something else that can be considered for skin tightening. That would be the answer in terms of lasers for the eye area.
Okay. Now, as far as, obviously, we don't want to lose any fat under the eyes, and we will be talking about facial fat loss in general. Mm-hmm. But is that a risk with any of the lasers you just mentioned?
That's a great question, actually, because people confuse lasers with energy-based devices and they think it's interchangeable. They're actually completely different devices. Lasers are so superficial. They aren't used. Energy-based devices go over that area and they slowly, intentionally increase the temperature of the tissues. And the machine actually reads and interprets the temperature of the tissue, and it has a goal and it slowly increases that temperature. Lasers don't work that way at all, and they're very superficial. So they really only work on the epidermis and the dermis, and they don't go into the subdermis. So they never, ever heat up any subdermal fat. So you'll never lose facial fat with a laser. With an energy-based device, you absolutely can.
That's good to know. Thank you. Now, another... it's not so much a question. Some people were upset or misunderstood when we talked about peptides in the last video. You mentioned that peptides are a big molecule, and without the right delivery system, you're basically wasting your money. So people took that as peptides don't work. Can you just explain a little bit more what you meant when you said that?
Yeah, absolutely. So there's something called the 500 Dalton rule, and the Daltons are a measurement of size of molecules. And the rule is that anything under 500 Daltons is easily absorbed into the skin. So for example, glycolic acid is one of the smallest molecules and it's 76 Daltons. That's why I always say you don't need to buy an expensive glycolic acid because there's not much to it. It will get into your skin no matter what the formula. So you can focus on other formulatory elements and not the glycolic acid itself. Glycerin is 92 Daltons. Things like retinoic acid and vitamin C and steroids are under 300 Daltons. But then we get into larger molecules. So the smallest peptides are generally over 700 Daltons, but they can get much, much bigger than that. So the chance that that's going to penetrate into the skin is a lot smaller. It's just going to sit on the surface. The skin is not going to let that large molecule in, just like hyaluronic acid is a large molecule. Hyaluronic acid can be over 500,000 Daltons. They're just going to sit on the skin. So if you want that peptide to get into the skin, you need to put it in an envelope, so to speak, whether that envelope is something like a liposome, like something fatty that's going to penetrate through the fatty layers of the skin because fat likes fat and water likes water. Or if it's a charge, if it's got a positive or a negative charge, that's going to help it get into the skin. But you need something that is in the formulation that will drive that peptide into the skin. Otherwise, you have a peptide that's just sitting on the skin. And if you feel the product benefits you, it's probably not the actual peptide. It is the other ingredients in that formulation that are either benefiting your skin or making your skin feel nice. But the other thing I want to clarify, I feel like there's a lot of confusion on what a peptide is. And so people just know it's a little bit like exosomes. It's like a code word that actually means nothing in and of itself, because all a peptide is 2 amino acids strung together or more. Mm-hmm. And once you have enough amino acids and one peptide combines with another, then you have a protein. But peptides can be so many different things. They can be enzymes, they can be hormones, not that they can be, but they are. Peptides are enzymes, they're hormones, there are carrier peptides, so they carry other molecules from one cell to another. They can be messengers where they are sending a message. Peptides also sit on the outside of cells. They're almost like guards that are watching the environment. And once they sense something is off in the environment, they let the cell know right away whether, danger is in sight or something is off, and the cell has to compensate for that, maybe turn certain genes on and off. So peptides can be so many things. They can be growth factors, cytokines. When we're talking about skin peptides, we're usually talking about peptides that will, in one way or another, boost our collagen synthesis. And so whether they are growth factors or other elements that stimulate fibroblasts, well, we know fibroblasts live in the dermis. So for that peptide to have a positive effect on collagen production, it has to reach the fibroblasts, which means it needs to get through the epidermis, the dermal epidermal junction, and into the dermis. And that's why I say, unless a brand has a really good formulation to get those peptides in, you're wasting your money. So that was what I meant.
Can you recommend some brands that you like that have some peptide products?
Yeah, my favorite peptide brand is Elastin. And the reason for it is that they took tissue biopsies and they looked at them under the microscope, and they actually showed a difference before using the product and after using the product. And they have a liposomal coating. Another brand is Skin Better Science. They have liposomal coatings, but Elastin would be my go-to peptide product. They are pricey, but if I wasn't going to buy a quality peptide product, I just would avoid peptides. And there are so many other good skincare products you can buy if you want to avoid peptides. If you use retinol and you're stimulating your fibroblasts through the action of retinol or tretinoin, you're still going to be producing collagen. You're just going about it in a different mechanism. Or if you get a laser treatment, you're also going to be stimulating your fibroblasts to produce collagen. So peptides aren't essential. They're not going to make or break your skincare. But I just think it's important to know that if a peptide serum doesn't have a vehicle or a driver to get it into the dermis, it is a waste of money.
That makes sense. Thank you.
Yeah, my pleasure.
Now let's talk about facial fat loss.
Okay.
It's something obviously I dealt with this year. I lost a ton of facial fat. Strangely enough, I didn't notice it at first until I got some mean comments under my videos. Looking back now at those videos and looking back at pictures from then, it's scary looking. But when you see yourself in the mirror every day, you don't realize it. But since I talked about it and since I found a solution, I have gotten many, many comments from women, even some men who also struggle with facial fat loss, and they're asking what can they do to address that. Obviously, I did Renuva, which is not available in the United States yet.
Correct.
So if I came to you back then with my face very sunken in, what sort of treatment would you suggest?
I saw those photos of you. I actually watched those videos. I was fascinating because that was the first time I came across Renuva, which is not available here. And I also think it's fascinating that technically it's like Sculptra, polylactic acid, yet there's something different about it. Because I also know from your videos, your Sculptra journey, you had Sculptra done multiple times without much effect, but the Renuva made a difference. Mm-hmm. So starting with Sculptra, I would say in the US, this has been the go-to product for years. It's really the only one. And the problem with Sculptra is that it really depends on your body's immune response to it. So if someone is elderly, so the older we get, the less of a response we have. So it's anticipated people will need more treatments, more vials, more visits for re-injection, because that response isn't as robust as if a 30-year-old or 20-year-old comes and gets a Sculptra treatment. And that immune response is just so strong, they just produce more collagen from the treatment. So that's the only sort of side effect, because usually volume loss is age related as well. There's a new product on the market. It's not been around for very long, called Renuva. It's quite expensive, but it's a completely new technology. It's essentially a matrix. It's almost, if you imagine a honeycomb that is injected into the skin, into the layers where the fat is. And that honeycomb has growth factors, collagen, and proteins that attract fat cells from your body to fill that honeycomb, kind of like honey would fill a honeycomb. And so the matrix recruits the fat cells attach to it and start growing in that location. And then the matrix itself dissolves after about 3 months. The only thing to keep in mind is that the reason why this is such an expensive treatment is because that matrix comes from donor tissue. So donor tissue is processed in a way to create this matrix, which is then available for purchase and injection.
Okay, so this is similar to Sculptra, which stimulates, or Leah, which stimulates collagen, but it actually stimulates your fat.
It stimulates your fat to kind of deposit on this honeycomb.
Okay.
So the goal isn't collagen, because we're trying to replace fat. We're trying to get fat to go to a place where there isn't enough of. And so this matrix attracts fat cells to attach to it and stay there permanently.
Permanently. So this is not something that wears off.
You know, with every brand, they'll tell you, oh, it's so many years. I believe they say 10 years, but don't quote me on it. But really, if a fat cell deposits and makes a home somewhere, unless it would die for some reason, there's no reason for it to migrate. So I think that's why they say the longevity is 10 years.
That makes sense. Versus collagen, we do lose collagen every year. So even if I'm building more collagen with a collagen stimulator, it's still degrading over the years.
It's just the nature. It's like hyaluronic acid. We degrade it every day. We build it every day.
Have you done this treatment? Have you used this particular
I worked in an office where we used it. I've never had it done to I don't think I need much fat in my face. I've always had it.
I didn't mean sorry, I didn't word that correctly. I didn't mean, did you do it on yourself? Have you treated people with it? Sorry.
Yes. Yes. And the results were beautiful. Very, very natural. And the difference is you can really get that volume in places where you can't do Sculptra so much. Like, you know, places where our face animates a lot is high risk for nodules with Sculptra. And it is a little bit of a different look. Sculptra gives you that Sculptra glow, but this really filled the face. So I've seen really nice results from it. It is I don't know what the range is, but I know it's about $3,000 a syringe. So it's quite pricey.
And how many syringes? So again, if I would have come to you back then with my sunken in face, how many syringes would I have needed, do you think?
You would have needed quite a bit. So maybe 1 or 2 in your first treatment, but you'd be coming back every few months, because you want to give it time to start working. It's a little bit like Sculptra in that sense. You want to give it time to start working to see. You don't want to overfill. You want to see how that facial fullness is coming along, and then you reassess and re-inject. But it would have been multiple treatments for you for sure.
Okay. Now, but you also, I know you just did Sculptra yourself, and you use it in your practice. So I have heard from many women that it worked great for them. I have also heard from some that it didn't, just like it didn't with me. But it is something that you like to use in your practice. So you do see good results with it.
Yeah, okay. I love Sculptra. I'm a huge fan of Sculptra. I like it because it dissolves into glucose, CO2, and lactate. So even though it's a synthetic sugar, it washes away, or it metabolizes into natural products. And I love that it really does boost your collagen. It makes you look younger, but still natural. You don't look like you've had filler. You look like you, but younger. And so I love the results from Sculptra.
Now, it is strange, like you said, both Sculptra and Leah are polylactic acid. I did get a chance to look at both vials, and there is a difference in the appearance of the powder from the Lanuma to the Sculptra. So
I think I saw that video
yeah,
where you showed that. Mm-hmm.
so I'm assuming that the molecule size is different, and that
Mm-hmm.
because of that, I had a different response. Now, I've been accused by a doctor actually that I was sponsored by Lanuma, and that's why I'm talking about it. Which is, I wish I spent a lot of money on it, but it is curious that that one worked on me when the other one didn't really give me much results, even though it is the same product. Do you have any speculations to why that might be?
I agree with you. I think it's very, very interesting. But even if the molecule is a different size, understanding how it stimulates the immune system, I don't understand why one would work better than the other. I think that would be a really interesting research project.
I know that the natural injector, I don't know if you watch her, she made a video after many people had approached her after my video saying, why does this work and the other one doesn't? And she actually came across a study, not on Lanluma itself, but she said that Lanluma is actually a renamed Korean product that had been around for a while. And this study compared this Korean product, which is now Lanluma in Europe, to Sculptra, and it did show better results. So there is something about it that, hopefully at some point we will know. Hopefully it is approved in the United States at some point, and we will know what made the difference.
That is really interesting. Yeah, or since Sculptra and Luluma are available in Europe, maybe someone will tackle that there. But that would be really interesting to know.
It would be interesting to know. I know that here in Paris, there is a Sculptra expert. She has been working with just Sculptra for many years, and she just switched to only Lanuma because she also has seen better results.
Yeah.
So I'm not sure what it is. I wish we could answer that question. But
Really
I am glad, yeah, I am glad to hear that you do see good results with Sculptra in your practice, and that there is this new product now as well. And is there anything else you would suggest to somebody that comes to you with facial fat loss? Because it is something that really bothers people, because we do get mean comments, and we do look in the mirror and we look a bit scary or tired or sick.
Exactly. And also, there are some energy-based devices, particularly microneedling with radio frequency. If the settings are set too strong, there have been quite a few people who have had facial fat loss from these treatments that they went and paid for the benefits of anti-aging. So we're seeing more and more of that. But if I was treating someone like that, I would focus on laser resurfacing. We talked about the under eye area, but it really applies to the whole face. So if you do laser resurfacing, you are tightening that skin. Chemical peels also will tighten the skin to a degree, not nearly. Well, I shouldn't say not nearly. If you do the really strong ones, which I'm not a fan of anyway, there are chemical peels where you need to do them under conscious sedation. But within the realm of an outpatient visit, I think lasers do better. And so that would be to strengthen that skin and get more collagen production. Same with using tretinoin. So that at least alleviates that laxity. But in terms of volume underneath, I think it largely depends on the area of the face. So one of the reasons why I love Sculptra is you can do a pan-facial treatment and you really address most of the face. What I love about Renuva is that you can really address the face in areas where you really wouldn't do Sculptra. I think that if Lanluma was available here, that and Renuva might go head to head in terms of results, just because they're so much more pronounced compared to Sculptra. And you could do filler in certain areas to kind of help that volume, but it's not ideal at all.
And we did talk about filler the other day. We talked about hyaluronic acid and how I have heard more and more people talk about having side effects from getting filler. I had an email the other day from a viewer who actually sent me a picture. She's quite young. She's in her 30s. And she said she is really suffering because she has all these side effects from having had filler. So have you ever seen anything like that from hyaluronic acid fillers, that they possibly cause an inflammatory cascade?
Absolutely. They can cause, it's usually delayed reactions, which is what's so interesting. So it's years after the filler injection, and patients can develop granulomas and have these side effects. And then it can be difficult to even dissolve the filler because it's not really the filler anymore. It's the cascade of reactions that happen that you can't dissolve because it's the body's response. It's an immune response to the filler. So it's not that common. It doesn't deter me from either getting filler personally or injecting it into someone. But one of the things I've started being, well, I've always been, but one of the things I think is extremely important is to really, really cleanse the face. I mean, I've seen injectors just swab with alcohol a few times and go straight in. And I think it's imperative. You want to reduce the biofilm. You want to reduce any kind of bacteria making a home together with that filler, even if they don't cause an infection, because there could be a bacterial component that's related to these long-term reactions. So using an antiseptic and alcohol and a facial cleanse, I will triple cleanse the skin before I will inject filler for that reason.
Have you seen any of those delayed side effects from Sculptra or biostimulators?
The only thing I've seen from Sculptra, not my injections, but I've seen patients have the nodules, which isn't uncommon. And particularly here, because again, the reason, the thought behind the nodules, or one of the thoughts, is that they aggregate. And where you have Sculptra that's too concentrated, you're much more likely to get a nodule. That's why the massage is important. That's why actually the incidence of nodules has diminished since they've changed the dilution. The recommended dilution now is a total of 9 milliliters of fluid in the vial. It used to be less. And they've noticed that with the 9 milliliters, the nodules have decreased in incidence. And so I think it's just the dilution makes the difference.
Okay. I know that Dr. Guzman, who did mine, also likes to dilute it at least 24 hours ahead of time to avoid nodules. Is that something you do as well? Or is that
the prehydration? I don't do it. And the reason I don't do it is because Galderma did the study, and it was Dr. Sabrina Fabi out of San Diego. They looked at Sculptra that was prehydrated a week earlier, the day before, and the day of the treatment. And they compared it in terms of, does it actually need to be prehydrated? Because that was the recommendation. And they found that Sculptra in and of itself doesn't actually absorb any of the water. So the analogy they used is a golf ball. If you take a jar of golf balls and you put them in water a week ago, yesterday, and today, is there a change in the golf ball? No, absolutely not. And they showed that in a study that it made absolutely no difference. And so from that, I decided not to prehydrate. So I never do. I always mix it. I shake it really well. I have a vortex, so I do spend a lot of time mixing it really well, but I don't prehydrate.
Okay. Now, we talked about threads last time. Threads are a similar material to Sculptra. And we talked about some surgeons saying if you want a facelift down the road, to not do threads because of the scar tissue. Is the same true with Sculptra? Is that something that you hear, that if you want a facelift down the road, which is not in my cards, I don't think, well, never say never, but I don't.
Never say never, yeah.
I'm so afraid of anesthesia. That holds me back.
Oh, that's what it is for you.
That's what general anesthesia. Oh, it really scares me, which is probably a good thing.
Yeah, that is a good thing. For me, what scares me is the idea of having my face cut open. But
that too.
But I love the results of facelifts. It's so funny that you're asking me this, because I just filmed a video on this and it's coming out very soon. This whole entire topic, because right now there's a very heated debate about this, and surgeons are getting angry. There's two camps. One camp says it's fine to have Sculptra, it's fine to have threads, and the other camp says no, it causes scarring, it makes surgery more difficult, and they're very much against it. And so I've seen a few dermatologists and plastic surgeons talk about this in a very collegial way, and I loved what they said. So essentially, from the point of view of the surgeon who's going to take anywhere from $50,000 to $150,000 for a surgery, you can imagine he wants to do the best possible job. And preferably have no surprises along the way. So a face that's never been injected is like a dream plane because it doesn't pose any of the complications that might come along with scarring. So that's that camp. However, the reality is that some people get Sculptra, they get threads, and even though they've had those treatments, there's really not a lot of scarring, and the surgery isn't more complicated by these prior treatments. However, some people, again, back to that spectrum, will scar terribly, and you can't predict. And so for the anecdotal certain case, or for the anecdotal number of cases, that's enough for some surgeons to say, I don't want to deal with that, especially when my goal is a good outcome and I'm taking a lot of money and responsibility for this person's face. What I think is funny is that many women are now getting facelifts younger and younger, and they're getting revision after revision. Every decade, they're getting a revision. And you can imagine the scarring after a facelift is far more than any Sculptra or thread could ever do. And surgeons perform them. And they know that that surgery will be more challenging, but it's still done. And so I think that the idea that Sculptra and threads can cause much damage is very small. And the interesting thing, the thing to remember is that when a face is treated with threads and Sculptra, the plane that you want to be on for Sculptra, for example, is just underneath the skin in that fat layer. So we have skin, fat. Then we have the SMAS, which is that layer that the surgeons operate on. That's where the muscles are, the arteries, the nerves, all the important structures of the face live in that layer. And that layer gets pulled during a facelift. Underneath that layer, we have fat again, and then we have the bone. So when Sculptra is injected, it's usually ideally injected on bone or just underneath the skin. So you should be nowhere near where the surgeon's going to be for the facelift. Mm-hmm. And same with the threads. However, the exception to that would be if someone isn't a good injector and they don't inject in the plane that's intended, because Sculptra has been seen on the fascia of this muscular SMAS. So it has been seen there, probably because someone injected and didn't have really good technique. And the one example I'd love to give, I don't know if you've heard of Dr. Shinobe Aguilera. He's a dermatologist out of Florida who is 56, I believe, but he started doing Sculptra when he was 37. So I've followed he's one of the Sculptra gurus that I look up to. So he's done routine Sculptra for decades, and he just had a facelift. And so that was one of the topics that they discussed with the surgeon is it's going to be a more difficult surgery. I've been doing Sculptra for decades. And what the surgeon said when the surgery was done, there was no problem. There was no scarring. There was no problem. So you never can predict how someone's body will respond to a product. And you never know. It's just, are you willing to have that conversation?
When I talked to Dr. Guzman, when I had my very first Sculptra injection, we did a little interview, and she said that Sculptra or biostimulators are contraindicated for certain people. For example, if somebody has an autoimmune disease. Do you agree with that? Are there contraindications?
100%. Absolutely. Yes.
Why is that?
Well, because the whole premise of the way Sculptra works is by stimulating the immune system. So if the immune system is not healthy and is not in balance, let's say, you could exacerbate their condition. You could cause a flare. And so you really don't want to be playing with the immune system that's already got some sort of lack of harmony, let's call it that.
Would you say, and this has nothing to do right now with facial fat loss, but would you say the same is true with microneedling, for example?
Microneedling is a little different. I think that the main concern I have with microneedling is if people have a history of keloid formation. So depending on how they scar specifically, if they have abnormal scarring processes, I would not microneedle someone. If they have a flare up, whether it's Crohn's disease, like if it's a gut immune disease, or if it's a thyroid, any active inflammation, I think is not a good time to be treating the body by stimulating a healing response. Because when you're stimulate, whether it's laser, whatever that is, when you're stimulating a healing response, you're activating the immune system. You know, when we think about PRP is so popular, platelet-rich plasma, that is largely from platelets, and platelets are part of the immune system. So if the immune system is out of balance, I think that it's wise to not irritate it with any types of treatments. Just like if someone has a sunburn, or if they have a herpes virus outbreak on their lip, you wouldn't go ahead and do a lip filler or any kind of facial treatment, laser or microneedling on their face until it calms down. Because the goal always is do no harm. And all of these procedures are elective. So you want the best outcome possible and not to put a patient through more suffering or more of a troubled recovery time. You know, the idea is you recover as quickly as possible and you have the best possible results.
That makes sense. Now, since you just brought up PRP, I have one last question for you. PRP or PRF, more PRF than PRP, some people say can also help with volume. Have you worked with that? Have you worked with PRF as far as?
I haven't worked with it by choice. And it's because I don't believe that. So PRP and PRF, if you think about it, it's like a concentrate of a healing response. You draw blood. So let's say you get this much blood drawn, and then you spin it so that you have this much of a concentrated product that you're going to then either inject or apply on the skin. And what is in that concentrate is to kickstart and turbo drive the healing response. So the downtime is less, the healing is quicker, maybe the collagen production is more stimulated, but that's really all that it is. And just like it's part of your, it's a constituent of your blood. So as soon as you inject it in the face, it's going to get resorbed and go back into your bloodstream eventually, not instantly, but it will. Your lymph will carry it out. It's going to go back into your blood. They're not long-lived procedures. They can help with healing, absolutely. So something like a vampire facial will result in the skin calming down much, much quicker after the trauma of the microneedling, for example. But I'm not a fan of injecting, for instance, PRF under the eyes. PRF is a gel. And the reason why it's a gel compared to PRP is because just as our blood clots after it bleeds, it's natural for blood to clot. And that's how we stop bleeding. So the clotting factors are in PRF. And so the reason why PRF is kind of a jelly substance is because those clotting factors start clotting. But you know that that's also going to dissolve. It's not going to last. And so because this area is so delicate and we have such a delicate network of lymphatics here, and PRF doesn't last, I don't believe in traumatizing this area, because the more you traumatize it and the more you scar it, the worse your lymph drainage is going to be. And you're going to start puffing and swelling, which is not ideal. And so I am much more of a fan of, if there's volume loss, to apply filler. That filler is going to stay there. That was one injection. It will last for years and there's minimal trauma. Whereas if you're doing something like PRF or PRP, you're going to just keep on re-injecting, and you're just hoping the body reacts and starts producing a little bit more of its hyaluronic acid and collagen, but it's repetitive trauma. I don't see the benefit in that. So that's why I don't do it.
Is there anything else you would like to talk about or like to add?
You know, under the eye, why don't we, I can't remember if we discussed all the therapies for under the eye. I know in today's discussion, we talked about the lasers. Other treatments I wouldn't mind mentioning is fat transfer is another procedure that people will get. The problem with fat transfer is it's a little bit unpredictable. You never know which fat cells are going to take and which fat cells are going to just wash away and basically die. And it can cause fat necrosis, which causes fibrosis. And I have seen this in my clinic because I do ultrasound. So I've seen girls that have had fat transfer and now they have these nodules and they don't know what the nodules are. And then when I looked with ultrasound, they've got fat necrosis, fibrosed fat necrosis. So that's something to keep in mind if you're considering a fat transfer procedure. And the other thing I would say that I also don't do because I'm not a fan of is the smooth collagen boosting threads under the eye. That's a popular procedure. A lot of people do it. And again, I feel that this area is so delicate and it's so easy to obstruct the lymphatics that to muck around with threads, because it's always going to be multiple threads that are inserted, and leave them there. I don't like the results. I don't like the look. I don't think it's worth it. I think it would be better to have a blepharoplasty if you're a candidate for it. You pull up that tissue and have a smooth look than to just put needle or put you're than to put needles in the face, because every thread is in a needle. So you'd have to put 5 or 6, and it's a lot of trauma for such a delicate area. So that would be my wrap up for treatment of the under eyes.
Okay. Well, but talking about fat transfer, it's not something you just can do under the eye. It would be for volume loss all over the face, but you're not a fan of it compared
well,
to...
it can be. The ones I've seen were specifically just under the eye. I think fat transfer, there are great things about it. For instance, it's your own body, which is always a huge, huge plus. It's natural. The problem with fat transfer is it's unpredictable. So if you choose to do it, I think it's fine, but you have to keep that in mind.
Now, one last question I have on the fat transfer, because that is something many people suggested when I struggled with not getting results from Sculptra. They said, why don't you just do a fat transfer? It is unpredictable, as you mentioned. And is a fat transfer permanent?
In theory, but in reality, most people tend to lose those cells over time. It looks beautiful for a while. And I think, again, that's individual dependent. And it can last several years. And then they can start to see changes where that fat does get resorbed. Those cells start to die.
So if you would have to sum it up, your favorite treatment for facial fat loss to this day would be Sculptra? Or
my favorite treatment... Well, I would have to put a caveat in this. I'm not a fan. It would be Renuva, but I'm not a fan of donor tissue, the whole concept of it. That's very personal. Just like I wouldn't have a facelift. It's very personal. I love facelifts. I think women look beautiful. I wish I wanted one. It's just the surgery is just, I know too much of what it looks like, and it's too violating for my my personality. So I think Renuva is brilliant, and that would be my number one. But personally, I don't like the idea of donor tissue. And so for that reason, it would be Sculptra. And I have a feeling that if Lenluma was available here, it would probably be that.
Well, Dr. Ania, as always, this was awesome. I could talk to you all day. Thank you so much for being here.
Thank you so much for having me. It was very, very nice. I love being on your channel. It's a lot of fun.
We love having you, and I hope you will be back soon.
Thank you so much.